I'm Dr. Ramesh Mehta, CBE. I'm the president of British Association of Physicians of Indian origin. And it's been a pleasure for me to be chairing a session at the APNA conference. So I founded BAPIO in 1996. And the reason to start this organization at that time was there were a lot of doctors coming in from overseas and they were not getting appropriate jobs. GMC was taking exam for these doctors to get license, which they would get, thousands of them, but there were no jobs. And poor doctors, without any financial assistance, they were doing jobs on petrol pumps and things like that. So we thought we need to do something to help these doctors. So this is how the organization started in '96. However, over the years it has grown big. We believe in equality, diversity and inclusion. We are big on that. We have challenged the establishment, including Department of Health, the Home Office, the GMC, the Royal Colleges, to ensure the equality of opportunities and to avoid discrimination of ethnic minority doctors. So 40 years ago, when I came to this country, there was a huge problem. With the sort of work me and colleagues like myself and the organizations like ours have been doing, things are steadily getting better. However, still long way to go. But I believe that the COVID-19 made a big difference in thinking of the local population as to how credible and the ethnic minority population has been. And you know the number of people dying during the COVID, all ethnic minority people, and the contribution they have been doing to the health service in this country. So things are beginning to change, but I believe still there's a long way to go. Okay, so those days it was difficult. On the street I was called various names, Pakis and things like that. I failed the exam several times, although my consultants and patients thought I was a very good clinician, although eventually I passed the exam. So discrimination was there. Now, because I went through that, I thought I need to do something when I was in a position. So when I became a consultant in the NHS, I then had opportunity to do something, and that's how I started this organization, which I think has contributed very significantly to improving the situation as it is now. Well, this was, I thought, a very important session. It was about inequalities in the primary care. So how our patients are suffering because of inequality. And we had brilliant presentation from three different speakers from three different angles. And I thought there were lots of lessons for us to learn. And I believe that as an organization, APNA, which constitutes healthcare professionals of all different types from South Asia, can contribute in a significant way in reducing inequality. Because all this staff at different levels, starting from chief executives, medical directors, coming to the porters and cleaners and the nurses and so on, everybody together in APNA, which is an amazing organization. And I think we together can influence the establishment in reducing inequality for our patients. There was talk about the differential treatment of Bangladeshis and Pakistani women, for example, the patients suffering with diabetes, the dementia problem, which is coming up in a big way. All this can be assisted in a significant way through APNA.